Ever wondered how a dentist fills a cavity? It's a question that piques the curiosity of many, especially since it's such a common dental procedure. Most of us will experience it at some point, yet the process remains a mystery to many. Let's demystify it. It's not a horror movie scene, rather, it's a routine, well-practiced technique designed to save your tooth and prevent further discomfort. So, buckle up for a journey into the world of dentistry as we delve into the process of filling a cavity. The first step in filling a cavity is the examination. This is where the dentist plays detective, using an array of specialized tools to inspect the teeth. Mirror and probe, the dynamic duo of dental instruments, help uncover any hidden cavities. The mirror, with its reflective surface, illuminates the hidden corners of the mouth, while the probe, a long, thin tool, gently taps and scrapes the teeth to detect any soft spots, a telltale sign of decay. To further confirm the presence and extent of a cavity, X-rays are utilized. These images provide a detailed look at the teeth, bones, and soft tissues, revealing cavities that might be hiding between the teeth or underneath existing fillings. After the detective work is done, the dentist will then discuss the best treatment options. This could be a simple filling, a crown, or in more serious cases, root canal therapy. Once the dentist identifies a cavity, he prepares for the next step, which is numbing the area. Numbing the area is crucial to ensure that you don't feel any pain during the procedure. To achieve this, your dentist will use a local anesthetic, a substance that temporarily halts the transmission of nerve impulses in the area where it's applied. This way, the sensation of pain is blocked, allowing for a comfortable procedure. Next, the dentist takes a dental drill and carefully removes the decayed part of the tooth. This is a critical step to halt the progression of decay and prevent further damage. Once the decayed part is out, it's time to clean the area thoroughly. This is to ensure no bacteria or decay are left that could potentially cause further problems down the line. Then comes the filling. The dentist fills the cavity with a special material that hardens and behaves just like a normal tooth. This restores the tooth's shape and function, and it also prevents bacteria from entering and causing more decay. After filling, the dentist polishes the tooth to ensure it feels smooth and natural. This is the final touch to make sure your filled tooth looks, feels, and functions just like a healthy natural tooth. The process doesn't end with filling the cavity. Aftercare plays a crucial role in your dental health. It's important to refrain from eating or drinking for a few hours after the procedure to allow the filling to set properly. And don't forget the basics. Regular brushing and flossing are key to preventing future cavities. A little care goes a long way in maintaining a healthy smile. And there you have it, a step-by-step journey into the process of filling a cavity. Remember, regular dental checkups are the best prevention against cavities.